Hey, everybody. Jamie and Christine here from Iowa Diabetes. Welcome to Diabetes Awareness Month. It is November. World Diabetes Day is November 14th. And we've got a few things planned as a company to help create an awareness about diabetes. This is one of the first things that we have planned for that month, which is myth busting. There's some things that we hear as diabetes educators and providers that are common things that patients say to us that we just kind of want to bust them.
Exactly.
But starting tomorrow, our website, which is iowadiabetes.com, is going to do some different promotional things. And starting tomorrow, you'll get free access to our Diabetes Learning Hub.
This is pretty exciting.
It is. It's our education page where we include our blogs, our up-to-date videos, all of that information that we have with our tips and tricks that we're telling you. You can get access to all of that for free just by signing up on that website tomorrow.
And all in one place. So just easier to navigate and to find what you're looking for.
Instead of scrolling, doing that a scroll of death, trying to find when exactly did we talk about that. So check it out. Like I said, it's on iowadiabetes.com. There may be some emails going out too about that, but you can look directly there. So today is myths. So most common things that we hear and what we want to kind of dispel. But why is diabetes awareness so big? Did you guys know that over $327 billion annually is spent for the treatment of care for the disease of diabetes? So if we're able to bring down that money by talking with you about it, maybe getting you tested earlier, and helping you reduce your treatment costs. That's what we're here for. And that's our passion. That's our desire.
Exactly.
It is
and
why
reducing those complications, which are leading to those costs, right?
Absolutely. It is why we do our jobs. So myth number one, it is not safe to exercise if you have diabetes.
Oh, we definitely need to bust this myth big time.
Let's get rid of that myth. In fact, we want you to exercise. So exercise long-term is going to bring those sugars down. But there are some safety parameters around exercise that we want to do to make sure that when you are exercising, you're doing it safely. So some of those are what your sugars currently are, right?
Yeah, I mean, especially if you're on insulin, you want to be checking those blood sugars before you work out. Have a snack available if needed. But a lot of times I hear my patients saying, well, I don't want to work out because if I do, I go low. Or I have a snack before bed because if I don't, I go low. These patients on insulin, I say, well, you know what the main problem is? You're on too much insulin. Let's lower your insulin instead of omitting the activities that are going to help your diabetes and your health. So if you're noticing those things, if you're like, yeah, if any exercise, any activity, my blood sugars are dropping, or having those issues before bed or low blood sugars in the morning, please talk to your provider because those are some indications that your baseline insulin rate is too high.
Absolutely. And we want you, just like you said, we want you to exercise. Exercise long-term helps with your sugars, but it also helps with heart health, which is cardiovascular disease as well. That was October. In addition, we want you to check your sugar, like Christine said before, but have a snack available wherever you're exercising. So if it's a gorgeous day here in Iowa, so if you're on a bike ride or a walk outside, you have a source of a carbohydrate just in case you do happen to start to feel like you're going low. And then always stay hydrated. So have your source of water with you as well.
Another thing I talk to my patients too, especially if they're on mealtime insulin, let's say you're going to eat lunch and then you exercise like around 3. Sometimes I'll have my patients not bolus quite as much at lunch if they know they're going to exercise afterwards. Because, although sometimes exercise can at first increase those blood sugars, then they're going to drop them low later. And so sometimes there's some changes to that insulin routine depending on what time you're going to exercise. So definitely something to talk to your provider about as well.
Absolutely. Myth number 2. Okay. My sugars are normal. I can stop all my meds. I'm cured. What do you think?
That is a myth, but sometimes it's not a myth.
Yeah.
It's kind of in between, because sometimes with now for type 1 diabetics, your pancreas isn't working. And so you do need to take your insulin. So if your blood sugar is in control, that is fantastic. You have a great regimen. Keep it up. But for type 2 diabetes, lifestyle modifications, doing those resistance exercises, getting the exercise, eating a good healthy diet, you can reverse diabetes and go off your medications.
Yes.
But you don't want to just stop them without talking to your provider.
Right. There's going to be a safe way to do it.
Exactly. A lot of times I'll use a tiered approach where I'll take off one medication, then I'll check and see how those blood sugars are doing, because I don't want to just cut everything cold turkey and then blood sugars go through the roof and now we're almost starting from scratch again.
Yeah. And I hear this one a lot from those that take insulin, where my blood sugar is normal, even if they're on mealtime insulin, or sometimes even those long acting. My blood sugar is normal. So why should I take insulin before a meal if my blood sugar is, let's say, 90? If you're going to sit down and you're on insulin, if your blood sugar is 90, but you're going to eat, your blood sugar is going to rise.
Right.
The purpose of that mealtime insulin is to prevent those highs after a meal.
Exactly.
If you don't take the insulin, you're going to spike up to 200 and 300. And then you're going to have to take the mealtime insulin later, which is going to then drop you down.
Yeah.
If your body's going on that roller coaster, you're going to get tired on both directions.
Exactly.
And you're just going to not feel and have that good energy and have that good quality of life that we're wanting to. So even if your blood sugar is normal, so I would say between 80 and 130, absolutely take that insulin if your doctor wants you to take it. Now, if you're low before a meal, like less than 70, there are some things, and they're going to be very specific. So do talk with a pharmacist or a provider for what they want with your specific regimen.
I agree. Okay, here's one that we've been seeing more and more of. Only children can develop type 1 diabetes, and people over the age of 65 develop type 2 diabetes.
So type 1 diabetes only in kids, type 2 only in adults.
Yeah, is that true?
Absolutely not.
No, it's
actually not. So we're seeing more and more type 1 kind of being, and LADA is what it's called, being diagnosed later into adulthood. I've seen it as even after the age of 50.
Yeah.
So for those of you who are 50 to 60, you're not out of the woods yet, but hopefully.
Well, so how do you know?
Yeah.
It's confusing. You're like, well, I was told I have type 2, but now like I'm on insulin right away. Like I'm so confused. You hear that a lot from patients. So how can you test to see what type of diabetes you have? I get asked that all the time.
Yeah. So there's certain tests that our doctors and providers here do order. There's some certain antibodies. So type 1 diabetes is an autoimmune disorder, meaning our body creates something and it slowly destroys the part of our body that makes insulin.
Right.
We can test for those antibodies to see if those are in your body. And then we can also test to see how much insulin you're making. So we can do those couple of lab orders along with getting a sugar level at that same time. And then we can see if you're more likely to have type 1 or type 2.
Right. And because the treatment changes for that as well.
Absolutely. And it's common because a lot of these patients that are coming and we're re-diagnosing them as that type 1 or the LADA, they're a little bit on the heavier side. They have a lot of the same risk factors that would go into type 2 diabetes. Like they may have high blood pressure. They may have been on medicines that seemed like they were working for a couple of years, but then all of a sudden it's like nothing is working.
Yeah.
So when we hear those stories, that's when we start to do some of those testing, and the little alarm bells go off in you and Dr. Bhargava's mind, and I see your guys' mind kind of going. But it's sad to say the same thing's happening on the kids' side.
Yeah, it's the reverse. We're seeing more kids with type 2 diabetes.
Yes.
Because of the rate of increase in obesity.
Yeah, and so the higher rates of obesity in kids is absolutely putting some of that population at risk. So diabetes is being diagnosed in the teens and the kids more often now. Good thing with that, there used to be only insulin. Only insulin is what we used in kids, but more and more evidence with metformin and now Trulicity and Victoza. So getting better treatment options for that population.
Which is nice.
Okay.
All right,
so
here's another one.
Yep.
Okay. Do you want to read it?
Yep, I got it.
Okay.
Type 1 diabetes is the most severe form of diabetes. No.
Nope.
No.
No, unfortunately, a lot of the things that come with type 2 diabetes, with those blood sugars being high, the metabolic syndrome, the increased cholesterol, the damage to blood vessels and nerves, you can see more severe complications in type 2, sometimes even than type 1. But all diabetes not controlled can cause some very severe complications.
It's more about how high your A1C is than anything else, not the type 1 versus the type 2. That's just how you develop the high sugars.
Right.
We then look at your A1C, and that tells us your severity and your risk for complications. So most patients go for an A1C greater than 7%. But those complications,
or less than 7%.
Yes, sorry, less than 7%. But complications, they start to sneak in, and your risk starts to go up above that 7%. Definitely above 10. We are going to be working with you daily, weekly to get those sugars down, because that's when your risk is greatest.
Yep, exactly. And then what is this one? You can't eat carbs if you have diabetes.
I hear this all the time. I can't eat that food.
No.
I've got diabetes. I can't do it. So there are certain foods, and that's a myth.
It is busted.
Absolutely a myth. Patients with diabetes can have carbs.
Yeah, and your body needs carbs. Your muscles use carbs as fuel. Your brain uses carbs. So you definitely need carbs, whether you're diabetic or not. Yeah. But there's different kinds of carbs.
It's the type of fuel that your body gets. And there are certain types of carbs that might be better than other types of carbs. Every person, about 40 to 50% of your calories should be from healthy carbohydrates. I'm not saying go out there and eat only cookies, because that is a carb. But carrots are carbs.
Yeah.
Corn is carbs.
All of your vegetables,
all your fruits. It's about portion.
Exactly.
And it's about picking the right type of carbs and keeping them to a correct portion size throughout your entire day. You need carbs.
And your kidney doesn't like it if you don't give it carbs, if it's just all keto. I mean, for those with diabetes, we know your increased risk of kidney damage, and doing an all keto diet worsens that even further.
So Grace is asking us a question. What is my favorite carb? I'll tell you my favorite carbs, and I'll go healthy carbs. My favorite carb is going to be corn. Okay. And corn is a vegetable, but it's considered a starchy vegetable. And I can have a quarter of my plate being a starchy vegetable like that.
Exactly. I just made some hummus recently. So, your chickpeas, that's going to be a carb, but have a ton of protein and nutrients. So I'm going to be munching on that all this week.
Yeah. So if you're watching that later, let us know what your favorite healthy carb is. And maybe it's something that someone else can incorporate into that. So just remember, like we said, we want about 3 to 4 servings of carbohydrates every single meal. So that would be anywhere from 45 to 60 grams of carbs in a meal. And as long as you're balancing that with a lean protein and your non-starchy vegetables, that's going to create that balanced meal for you.
And that may change a little bit based on activity level, based on what you're doing for weight management. But what you don't want is to have that 0 carbs. Any diet that tells you that bacon and cheese only are healthy is lying to you.
And now Kathy is asking a follow-up question. Thank you. Welcome back, Kathy. So why does no carbs increase your risk for kidney disease?
Well, those ketones and so forth have to be processed through the kidneys, and that can put a lot of extra taxation on those kidneys. And we don't want that, right? You're making your kidneys work harder than...
So, if your body doesn't have carbohydrates, there's certain parts of our body that only use glucose for fuel. So they break down fat, and then they break down that fat, and a byproduct of that is the ketone. And it's the processing of that ketone over and over and over that damages that kidney, like Christine was saying. So it puts a lot of stress on the body. And that's why just giving yourself, even if it's I mean, I sometimes don't even get 3 servings of carbs in my meals, but even if it's just 2 servings of carbohydrates per meal of a healthy carb that your body can appropriately process, it needs it. And we can just balance it with the medicines that you're taking. All good questions. We busted these today. 5. Now, if there's other questions that you're like, I've heard this about diabetes, let us know. We want to bust all your myths out there. So type them in. We will answer them after the fact.
And happy Diabetes Month, everybody.
Yes, be on the lookout for some of our emails and some of all the exciting events that we have coming for you this month.
Bye, guys. Have a great day.